So happy to see so many of you here because this is such a vitally important issue. Connecticut's Medicaid rates are discriminatory. With phase 1 of the rate study complete, there is no need to wait any longer to address the inequitable care and the workforce challenges that decades of underfunding has caused. As the good senator said, when we both became chairs of this committee, we heard from folks in our district, we heard from you. We had many meetings about the impacts of these low Medicaid rates. And here are just a few of the stories that stick with me. A dental cleaning in the state of Connecticut costs $120. Connecticut Medicaid just gives $20. I was told by a surgeon that the reimbursement for Medicaid doesn't even cover the knee replacement cost. And so he can only financially afford to do one knee replacement surgery for a Medicaid patient a year. Met with providers of autism services for children who were devastated that they can't be doing more for the Medicaid population of children, but they just can't financially afford to take those patients. And so there is a waiting list for Medicaid children in the state for autism services. And just last night at the Appropriations Committee public hearing, we heard from a radiologist that they make kind of an in-office joke that it would make more financial sense to just go out into the waiting room and give a Medicaid patient $500 and ask them to go elsewhere than to treat them because the rates are so low for radiologists. And so these discriminatory Medicaid rates cause two major issues in the state. They are creating inequitable access to healthcare for those with Medicaid in our state. And they're also contributing to the healthcare workforce crisis that we are experiencing in Connecticut. And so with over 1 million people in the state of Connecticut on Medicaid, we must take action. We can't wait any longer. And a recent tax incidence report illustrated that more than 800,000 people in the state of Connecticut make less than $22,000 a year. Well, the beginning rate for Medicaid, the eligibility rate, is around $23,000. So we're talking about a lot of people in the state of Connecticut who are on Medicaid. And these are children. These are children of substitute teachers. These are children of firefighters. These are children of social workers. These are our paraprofessionals. They are our personal care attendants. They are our neighbors. They are our friends. And so it is long overdue that we address these discriminatory practices, the discriminatory Medicaid rates, and looking forward to having this meeting to dive deeper into phase 1, but really just committed to working with my colleagues in the House and Senate to push for change and to help both individuals on Medicaid and the workforce who wants to give them care. Thank you.